So one of the interesting about Tjugito is that he had a history of childhood polio, and he also had heart disease, which was stented before. So because of his polio, he also had restrictive lung disease, which affected his lung capacity. So when he came to us seeking treatment for his prostate cancer, I was a bit surprised in view of his medical conditions that he was offered surgery.
I feel difficulty in when peeps, and so I saw my friend asked me to see the doctor. To my surprise, the PSA is 7. So the doctor told me to get MRI to see what is this. That is, yeah, I feel like it's the end of the world. A disaster.
Okay.
Because I know cancer is not a easy disease that can be cured. That is what I feel.
I think it's to convince him that everything will be alright and everything will be okay very, very soon, and not to worry too much about the cancer or the treatment, because we have heard so many successful stories, and as we see the technology itself, we are reassured that everything will be alright.
Shock and stress, but I'm also grateful because we can know faster.
Yes, I heard, because I have two options to cure my disease. First, by robotic surgery, taking off my prostate, and secondly is radiation. But radiation is in Indonesia is 24 times. There is these two options. I pray to God to get the direction, which one that I have to get.
I thought that radiotherapy actually would be a better option for him, because there will be no risk of general anesthesia with the treatment that could cure him equally as well as surgery. Yeah. So the form of radiotherapy that we proposed for him was SBRT, which is very suitable for localized prostate cancer, and especially so for patients coming from overseas, because it's a short and intense treatment which only takes about 2 weeks to complete from start to finish. So I thought that would be the most appropriate form of radiotherapy for him.
We want to find the best treatment and the least painful treatment for my father. So we of course discuss on several possibilities, and we find that ARO is probably the one that offers the best solution and the fastest way to cure this cancer. So we were quite involved. Everyone in the family is very involved in this case.
I found ARO by, if an Indonesian say, kebetulan. In my opinion, that is the direction of God, and I see that this is good because they don't take my prostate. So I called to ARO, and then the staff told me to have consultation with Dr. Jonathan. So I decided to have the consultation with Dr. Jonathan, and then Dr. Jonathan convinced me that they have their system with only 5 times radiation, and with 95% good result.
So because of his polio, he had what we call a very slow gut, and therefore he accumulated a lot of gas in his intestines. And the problem with gas is that it can actually go down to the back passage behind the prostate, and if the back passage is full of gas, then it could actually shift the position of the prostate and make the accuracy of the treatment diminished. So therefore, it's a challenge that we had to deal with because I would say that Tjugito was one of the patients who had one of the most amount of gas in his rectum in my experience.
Oh, the doctor and staff very helpful, very confident, and they said to me the word that I never forget. To Pak Tjugito, don't worry, you are in the right hand. Before, Dr. Jonathan said to me, after this process, maybe I have some side effect. Yeah, maybe a bleeding or something that's a little bit wrong, dizzy. But to my surprise, before and after treatment, I feel nothing, no bleeding.
I think he's doing fine. When I last corresponded with him, he didn't seem to have any major side effects and was living life as per normal, doing his work and basically just getting ahead with life after conquering this challenge.
Ya, saya sangat senang sekali dan makasih banyak pada Dr. Jonathan yang sangat baik sama dia, perawat-perawat itu sangat baik, benar-benar baik dan sangat care sekali sama suami saya. Dan saya juga saya juga terima kasih sama Tuhan karena suami saya kan tidak boleh dibius ya. Tadinya kan udah harus operasi, untung ketemu si ARO ya dan sama Dr. Jonathan dan itu bisa radiasi dan tanpa ada sedikit sakit pun.
Well, I think my mom was very worried and quite stressful, but for me, as I heard so many stories about Singapore technologies, especially in healthcare, so I was quite confident and I was certain. So in terms of emotional, because we are very confident and very trusting in terms of Singapore's ARO technology and Dr. Jonathan, so we were quite least stressful and we are certain that the result will be very, very good. Well, I think it was, told you, nothing to worry about. So, yeah.
Yeah, so one thing I noticed that despite these challenges, he actually had very, very few side effects, if at all. And he actually sailed through the treatment. It did take a bit of time, but in terms of side effects, he didn't have any side effects to report during the treatment and he went home straight away after his treatment was completed. So I think it was worth it to go through all that, rectal evacuations just to make sure that everything was on target and therefore he didn't really have any major side effects with his treatment.
Buat saya, perjalanannya saya happy. Pertama, treatmentnya cuma setengah jam. Setiap 2 hari sekali, saya seperti jalan-jalan di Singapura. Karena waktunya sangat kosong, setengah jam. Setelah itu kita nggak ngapa-ngapain, jadi kita jalan-jalan. Iya, so I know Singapore really well.
Okay.
Kemudian dokter-dokter dan staf juga sangat ramah, sangat membantu. But the professor from Indonesian University in Rumah Sakit Cipto said that yes, Singapore have more advanced technology than us, and the doctor Sam is very good. He never heard also about this therapy, but he said you can try it, and if you feel good, come to me and told me the result. I want to know also.
Yeah, so I think his family was very supportive and a very loving family. They stayed with him throughout, the time that he was inside the radiation room, just anxiously waiting for him to complete his treatment. And they were all very concerned about him. And I would say just a very loving family.
di Singapura jauh lebih canggih dan dokter-dokternya juga lebih ini, walaupun biaya mahal sekali, sangat mahal ya. Ya tapi ya yang penting bisa sembuh, kita udah nggak apa-apa lah ini.
I think number one is to stay positive. It is difficult to stay positive when you receive such shocking news, but rest assured is that as technology keep advancing in humanity, so I'm certain that there will be cure for every disease. So to remain calm and find out the best treatment for whatever cure that you need for the cancer.